A 52-year-old male patient arrives in the cardiac unit and is diagnosed with congestive heart failure. The cardiologist prescribes hydrochlorothiazide for him. Which of the following statements show that the patient understands your teaching about this me? A. Dizziness is a common side effect of this drug, so I need to get up the bed or chair slowly. B. My legs might get swollen when taking the medication. C. I should contact my doctor if I develop a cough with this medication. D. I might get constipated because of this medication, so I need to drink more fluids. Answer: A. Rationale: hydrochlorothiazide is a diuretic drug that is indicated for hypertension, heart failure, and kidney diseases. Dizziness is the most common side effect of hydrochlorothiazide. Quick changes of position may trigger dizziness, lightheadedness, or even fainting. Other common side effects include headache and stomach upset. 2. A public health nurse is conducting a community health teaching about heart failure. All of the following should be mentioned as risk factors for heart failure, except A. Obesity. B. History of preeclampsia. C. Increased high-density lipoproteins, HDL. D. Sleep apnea. Answer: C. Rationale: high-density lipoproteins, HDL, are known as good cholesterol because they carry cholesterol to the liver for excretion. Increased low-density lipoproteins, LDL, or bad cholesterol could cause a greater buildup of cholesterol in the arterial walls. This can eventually cause heart disease. Diastolic dysfunction is primarily seen in people with sleep apnea. Hypertension and obesity increase cardiac workload and peripheral vascular resistance. Hypertension is commonly seen in women with history of preeclampsia. 3. A 72-year-old patient came to the cardiac unit and is diagnosed with anterior wall myocardial infarction, AWMI. The nurse looking after this patient understands that the anterior cardiac wall is supplied with blood by which of the following arteries? A. Right coronary artery. B. Left anterior descending artery. C. Circumflex artery. D. Internal mammary artery. Answer: B. Rationale: the left anterior descending artery is responsible for the blood supply of the anterior wall of the heart. AWMI occurs when there is a lesion near the left anterior descending artery. 4. A 55-year-old male patient is showing signs of coronary artery disease, CAD, and is very anxious. What is the first nursing intervention that the healthcare provider should perform for this patient? A. Accommodate patient's questions regarding his symptoms. B. Give sublingual nitroglycerin. C. Help him to reduce his anxiety level. D. Improve myocardial oxygenation. Answer: D. Rationale: hypoxemia is a medical emergency that is common with patient diagnosed with coronary artery disease. Therefore, the first nursing action is to improve the oxygen supply to the myocardium. If there is acute angina, then sublingual nitroglycerin is recommended. 5. A community health nurse teaches a group of older adults regarding common heart problems. The nurse should tell the group that the most common sign of myocardial infarction is A. Swelling of the limbs. B. Palpitations. C. Chest pain. D. Shortness of breath. Answer: C. Rationale: the most common sign of myocardial infarction is chest pain, characterized as burning, squeezing, and/or heaving feeling. The pain can radiate to the left arm, neck, or shoulder. Shortness of breath usually follows chest pain. 6. A nurse is doing a focused physical assessment on a patient suspected to have heart disease. To assess the apical pulse of the patient, which landmark should the nurse use? A. Left second intercostal space, midclavicular line. B. Left first intercostal space, mid-axillary line. C. Left fifth intercostal space, midclavicular line. D. Left fourth intercostal space, mid-axillary line. Answer: C. Rationale: the nurse should look for the left fifth intercostal space, midclavicular line to assess the apical pulse of the patient. This is where the left ventricular apex and the point of maximum impulse are found. Pulmonary sounds can be auscultated from the left second intercostal space midclavicular line. 7. Upon doing auscultation to a 43-year-old female patient, the healthcare provider hears a murmur along the left sternal border, at the left second intercostal space. The healthcare provider suspects that the blood vessel involved is A. Pulmonic valve. B. Mitral valve. C. Tricuspid. D. Aortic. Answer: A. Rationale: the pulmonic valve can be auscultated from the second left intercostal space at the left sternal border. Murmurs are abnormal sounds of the pulmonic valve, which may suggest pulmonic hypertension. 8. A 64-year-old female patient comes into the emergency room with a chief complaint of severe chest pain. To assess myocardial damage, the nurse should expect the doctor to order which of the following blood tests? A. Complete blood count. B. Troponin I. C. Lactate dehydrogenase, LDH. D. Creatine kinase. Answer: B. Rationale: within 1 hour of myocardial damage, rapid elevation of the troponin I levels can be detected. A person with no heart injury has no detectable troponin I level. LDH is also helpful in the diagnosis of cardiac damage, however, LDH is also found in other body tissues and not specific to cardiac muscles. 9. A 39-year-old male patient diagnosed with myocardial infarction is prescribed morphine. Which of the following is the rationale for administering this medication? A. To reduce the oxygen demand in the heart. B. To decrease the anxiety level. C. To alleviate chest pain. D. To promote sedation. Answer: A. Rationale: the patient with myocardial infarction requires lowering of the oxygen demand to the myocardial tissues. Morphine helps to achieve this particular goal, although it can help reduce pain and anxiety levels. 10. A patient with congestive heart failure develops pulmonary edema. The doctor prescribes furosemide, Lasix, for the patient. In conjunction with furosemide, which of the following medications should the nurse ask the doctor to prescribe? A. Sodium. B. Potassium. C. Phosphate. D. Magnesium. Answer: B. Rationale: furosemide is a loop diuretic used in the treatment of cardiogenic pulmonary edema. Furosemide expels water along with salt and potassium from the body. A patient on furosemide should be monitored for decreased serum potassium levels. The nurse should query to the physician whether the patient requires a potassium drip to make up for the loss of this electrolyte. 11. A 47-year-old female patient who has a recent history of anterior wall myocardial infarction presents in the emergency unit with difficulty of breathing. Upon auscultation, the nurse hears crackles in the lungs. Which of the following medical conditions is associated to this sign? A. Tricuspid valve dysfunction. B. Left-sided heart failure. C. Pulmonic valve dysfunction. D. Right-sided heart failure. Answer: B. Rationale: crackles are usually heard in the lungs of patients with left-sided heart failure. A patient with AWMI may have decreased left ventricular function, causing the fluid to accumulate in the alveolar and interstitial spaces of the lungs. 12. A 55-year-old patient is showing signs and symptoms of coronary artery disease, CAD. To make a definitive diagnosis of CAD, the nurse should expect the doctor to order which of the following diagnostic tests? A. Cardiac enzymes test. B. Electrocardiogram. C. Cardiac catheterization. D. Echocardiogram. Answer: C. Rationale: cardiac catheterization is an important invasive procedure to determine coronary artery disease, as well as to find out the location of the myocardial damage. The other options can be helpful in diagnosis heart disease, but cardiac catheterization is the most advanced and definitive tool for diagnosing CAD. 13. A 69-year-old female patient is diagnosed with ischemic heart disease. The doctor prescribes which of the following medications to protect the ischemic myocardium by blocking sympathetic nerve stimulation? A. Nitrates. B. Beta-adrenergic blockers. C. Narcotics. D. Calcium channel blockers. Answer: B. Rationale: beta-adrenergic blockers such as bisoprolol and atenolol blocks the beta receptors in the myocardial tissues. This reduces the response to the sympathetic nerve stimulation, as well as the catecholamines. The workload of the heart is subsequently reduced, and the oxygen demand of the myocardial tissues are reduced. 14. A nurse is about to administer the third dose of digoxin. Before giving the medication, which of the following should the nurse check? A. Radial pulse. B. Respiratory rate. C. Apical pulse. D. blood pressure. Answer. C. Rationale. Before giving digoxin, the nurse should assess the apical pulse of the patient, because of the risk of digitalis toxicity, which is manifested by reduced heart rate. If the patient's apical pulse is less than 60 beats per minute, the nurse should not give the medication, and report the finding to the doctor. 15. A patient in the cardiac unit calls for the nurse and says, "I see some green halos around the lights. Should I be worried?" Which of the following medications may cause this side effect? A. Furosemide. B. Ramipril. C. Metoprolol. D. Digoxin. Answer. D. Rationale. Digoxin has several side effects, one of which is the green halo sign, which is a visual disturbance that may indicate digoxin, digitalis toxicity. The nurse should report this immediately to the physician for immediate treatment. 16. A 67-year-old patient is admitted with congestive heart failure, CHF. Which of the following medications will the patient need to elevate the level of cardiac output by increasing the contractility of the ventricles? A. Diuretics. B. Calcium channel blockers. C. Inotropic agents. D. Beta-adrenergic blockers. Answer. C. Rationale. Inotropic agents work by increasing the force of contractions of the cardiac muscles. This elevates the ability of the ventricles to contract, causing a rise in cardiac output. Epinephrine, norepinephrine, and albutamine are some examples of inotropes. 17. Many sympathetic nerves innervate the heart, affecting cardiac output and performance. Which of the following cardiovascular responses is to be expected from the stimulation of the sympathetic nervous system? A. A blood pressure of 82/59. B. A heart rate of 121. C. A respiratory rate of 28. D. A heart rate of 46. Answer. B. Rationale. The sympathetic nervous system affects the heart by increasing the rate of beats per minute. Option B is a sign of tachycardia and increased contractions of the cardiac muscles. Low blood pressure may be associated with the parasympathetic nervous system. 18. An 80-year-old male patient comes into the medical ward with nausea, a urine output of 10 milliliter per hour, and weight gain of 5 kilograms in the last 2 months. The patient should be evaluated for A. Right-sided heart failure. B. Cardiomyopathy. C. Left-sided heart failure. D. Angina pectoris. Answer. A. Rationale. Right-sided heart failure, also known as pulmonary heart disease or cor pulmonale, is a condition wherein there is less blood pumped into the lungs from the right side of the heart. As a result, the patient might have secondary signs of low urine output, nausea, and weight gain. 19. A patient is suspected to have abdominal aortic aneurysm. Which of the following past medical history can be a likely cause of this condition? A. Hypertension. B. Myocardial infarction. C. Angina pectoris. D. Arrhythmia. Answer, B. Rationale. About 2/3 of abdominal aortic aneurysm cases are caused by atherosclerosis, or the buildup of plaques on the walls of cardiac blood vessels. Atherosclerosis, if left untreated, leads to myocardial infarction. 20. A patient is suspected to have left-sided heart failure. All of the following signs and symptoms may be observed in this patient initially, except A. Edema of lower extremities. B. Pulmonary congestion. C. Dry and non-productive cough. D. Shortness of breath. Answer. A. Rationale. Pulmonary symptoms such as shortness of breath, dry and non-productive cough, pulmonary congestion and dyspnea are all associated with left-sided heart failure. Right-sided heart failure is characterized by edema of the lower extremities and congestion of peripheral and visceral tissues. 21. A 52-year-old male patient who has chronic hypertension is admitted to the cardiac unit due to cardiomegaly with reduced cardiac output. The nurse looking after the patient recognizes that all of the following are common related factors to reduced cardiac output due to hypertension, except A. Myocardial ischemia. B. Increased vasodilation. C. Increased vascular resistance. D. Ventricular hypertrophy. Answer. B. Rationale. Cardiomegaly is a medical condition wherein the heart is enlarged. Chronic hypertension can cause enlargement of the heart, which reduces the cardiac output significantly. Related factors to this condition include myocardial ischemia, increased vascular resistance, and ventricular hypertrophy. 22. A 74-year-old female patient is admitted to the cardiac unit and is suspected to have heart failure. The nurse hears murmurs upon auscultation of the patient's chest. This may indicate A. Incompetence of the heart valves. B. Reduced cardiac pumping action. C. Gallop rhythms. D. Non-compliant heart chambers. Answer A. Rationale: heart murmurs may indicate valvular incompetence. Reduced cardiac pumping action may be manifested by weak S1 and S2 sounds. Gallop rhythms of S3 and S4 sounds may indicate non-compliant heart chambers. 23. A patient is newly diagnosed with heart failure. Which of the following medications can help control the heart failure and increase cardiac output, without little effect on the heart rate and blood pressure? A. Digoxin. B. Valsartan. C. Lisinopril. D. Carvedilol. Answer C. Rationale: lisinopril is an ACE inhibitor, which is a group of first-line cardiac drugs that reduce ventricular filling pressures and increase cardiac output, controlling heart failure. ACE inhibitors have little effect on the heart rate and blood pressure. 24. A patient with heart failure is scheduled to have coronary artery bypass grafting, CABG. Which of the following is the primary purpose of CABG for this patient? A. To revascularize the cardiac muscles. B. To electrically stimulate cardiac muscles. C. To create multiple channels in underperfused, viable cardiac muscles. D. To temporarily support the failing heart. Answer A. Rationale: to improve the function of the cardiac muscles, they may need to be revascularized. CABG is the correct surgical procedure to achieve this goal. To electrically stimulate cardiac muscles, cardiomyoplasty may be needed. Transmyocardial revascularization is an innovative surgical procedure used to create multiple channels in underperfused, viable cardiac muscles. To temporarily support the failing heart, insertion of an intra-aortic balloon pump, IABP, may be required. 25. A 45-year-old male patient is newly diagnosed with stage I hypertension. Which of the following medications can be used to reduce his blood pressure, considering he has a relatively normal kidney function? A. Furosemide. B. Spironolactone. C. Bumetanide. D. Bendroflumethiazide. Answer D. Rationale: bendroflumethiazide is a thiazide diuretic that can be used to treat hypertension in patients with relatively normal kidney function. It reduces fluid retention, as well as the risk for heart failure and stroke. Furosemide, bumetanide, and spironolactone are also diuretics, but are the choice of treatment if the patient is resistant to thiazide or has renal impairment. What test topics would you like to see for nursing? Add it in the comments below.